I'm Dr. Nichelle Haynes.
And I'm Dr. Kristen Lassiter.
And we're Medical Mamas. This is your place to get evidence-based information about your reproductive mental health.
What that means is mental health in relation to reproductive hormone changes, like around your period, pregnancy, postpartum, infertility, and menopause.
Today we're going to be talking about ways to reduce your risk for postpartum depression.
So there's basically 6 ways that you can reduce your risk.
Right. Okay. Number 1, support.
Support is really important. Having a support network, friends, family, or it can even be professionals like a psychiatrist, therapist, doula,
Night nurse. Yes. And kind of other things outside the box, like having someone to walk your dog or outsourcing food or other things like that, so that the burden of taking care of the things is not just on one person. So I think that that's really important, and there's lots of different ways to have support, but that's definitely a really important thing for reducing your risk for postpartum depression.
The next thing is sleep. Sleep is so important, but it's also really hard to get good sleep when you're postpartum because baby's waking up all the time. But ways that you can do this is strategize with your partner or with a night nurse or someone who's helping you in your support network to divide up the night so that one of you is sleeping most of the first half of the night and the other one's sleeping the second half of the night. The goal is to get at least 4 to 5 hours of uninterrupted sleep, meaning that nobody's waking you up during that time.
Mm-hmm. With the ultimate goal of getting at least 7 hours in a 24-hour period. I always tell my patients, I know babies are not on board with this plan, but this is one of the times where you need to do what you need to do for you, and someone else is allowed to take care of baby so that you have the foundation of sleep so that everything else can kind of fall into place.
And if you're breastfeeding, one way to kind of strategize around that is pumping before you do your 4 to 5 hour of uninterrupted sleep. And then your partner or your support person can give baby a bottle of the pumped breast milk.
Mm-hmm. So I like to mention here when I'm talking to my patients about the sleep issue is that there's no shame, there's no judgment about if we're unable to get to that ultimate goal of 7 hours in a 24-hour period. It's just we're reaching towards that as much as we can on a consistent basis, that if we have a night where, baby's colicky or there's some difficulty for whatever reason getting the sleep that you need, that's okay. We're going to try to readjust. Because sometimes when people hear, oh, I'm supposed to be doing something, and they're not able to do that thing, that it can be, feel judgmental or shameful, and that's not the goal here. It's just that these are the recommendations that we have for prioritizing your mental health, reducing your risk for postpartum depression.
Exactly.
Okay, what's the next thing? Movement, getting your body moving. So of course, if you're postpartum, you definitely want to clear any kind of movement that you're doing with your obstetrical clinician, so your OB, your midwife, whoever was there to help you throughout your pregnancy. But getting some movement, whether it's walking with a stroller or if you're cleared to do it, some light exercise, is going to be a good thing for your mental health to reduce your risk or maybe even the severity of your postpartum depression.
Yes, and there's lots of programs out there to help you get back into exercising safely. So I definitely recommend not, just jumping right into what you were doing before, but finding somebody or a program that can kind of help you get back into things in a safe way. Also, the way I like to think of movement is positive body movement, because then it's not necessarily, again, this pressure of having to exercise or do a particular thing, but just getting your body up and moving around is really good for your mental health.
Mm-hmm. It's one of those things where we're going to incorporate the mindfulness of listening to our bodies and checking in with ourselves about what's feeling good, that we don't have to push ourselves to do anything that feels too much, but maybe today's a walk day, maybe today is a day to do a little bit of yoga or, whatever, just listening to your body. Garden. Okay, moving. That's good. That's a good one.
So the next thing that's really important is food. Food can be a great source of natural treatment for mental health. It may not necessarily treat and cure any kind of mental mental illness, but it's a great way to prevent and help reduce your risk of postpartum depression and postpartum anxiety.
So this means we're eating whole foods, things that are going to nourish our body. The way I like to talk about it is things that grow from the ground, that we're not wanting to do things that are super processed. And of course, no judgment. If what you need are some Cheez-Its this morning, that's totally fine. But we're going to try to prioritize little by little using things that are going to nourish our bodies. So if we can replace one cookie with an apple, that's wonderful. That we're going to try to prioritize things that nourish us.
Or another way to think about it is you can eat the cookie, but then also eat the apple. So incorporating things that are positive for your mental health. You don't have to necessarily cut out anything, but just making sure that you're incorporating a lot of fruits, veggies, fish, beans, legumes, all those good things.
Okay, what is the last one? Oh, medications, of course. So we're psychiatrists, and that means that we have training in talking about medications and having really extensive discussions about risk and benefit. So this, of course, is not going to replace the discussion with your physician, but oftentimes the least risky thing that you can do is stay on your psychiatric medications, because that has a lot of potential to reduce the likelihood that you have a true episode in the postpartum period.
Yeah, there was a great study done out of Mass General Hospital looking at patients who stayed on medications in pregnancy versus patients who didn't, and kind of the risk of relapse. And if you stop your medications and you have bipolar disorder, your risk of relapse during the pregnancy is like 90%. With depression, I think it's like 80% or 85%. And the greatest risk of postpartum mental illness is having mental illness in the pregnancy. So really staying on your medication can help prevent the mental illness happening during the pregnancy, but also postpartum.
That's why we talk about risk and benefit and what do things look like. There's a lot to go in that discussion. Maybe we can make a full video about just discussing medications.
Yeah, that sounds good.
Okay. So therapy is also a really wonderful thing that you can do to support yourself in the postpartum period. That there is a lot of evidence base to support therapy as a treatment and a risk reduction possibility for postpartum depression.
The therapies with the most evidence around them are interpersonal psychotherapy and cognitive behavioral therapy, but really just having a therapist that you have a great relationship with, that you feel comfortable talking through all of the ups and downs with, is probably good enough.
It's about being seen and being supported and feeling like you can be your authentic self, and therapy is a wonderful place to start that, have that.
Yeah, you need that.
Of course. Let's sum up. So, ways to prevent your risk of postpartum depression:
Sleep, diet,
food, exercise, maybe medications, support,
therapy.
Good.
6 things.
Thank you for being here today. If you like this video, please like, comment, subscribe. We'll see you soon.
Bye.